Okay, everybody's in.
Everybody's in. Welcome everybody to the virtual Southwood & Ferrers Health and Social Care Group annual general meeting for 2020. Thank you very much indeed for attending. I'm Peter Blackman, the chair of the Southwood & Ferrers Health and Social Care Group. Our able administrator, Nikki, is handling the technology. My trainee guide dog is taking an interest. If he appears, I shall say down Shep, which those of you who knew Blue Peter would take. The only trouble is his name's not Shep, it's Clarky. So, and I don't think he's ever seen me in a tie, but apart from that, everything will be fine. We haven't got any children, so it's just technology and animals we have to worry about. If you have any comments or questions as we go along, please use the chat function, which I can see, and we will be very happy to take comments and questions as we go along. And I'm very pleased to welcome Mike Gogarty, who is our keynote guest, and we'll get to him as quickly as possible. My aim is that this meeting will finish at the latest by 8 o'clock. So welcome everybody. We have a few apologies. I won't go through the whole list, but they include some of our city councillors like Bob Massey and Keith Bentley, who've got other commitments. So the second item on the agenda, if we can go to the next slide, please. Says he doing his best Downing Street. Thank you. So that constituted welcome apologies and introductions. The minutes of last year's AGM will follow swiftly on the next slide. And the slide thereafter. These minutes have been published for about 11 months. There have been no objections to them, and I will take those as being accepted. But if anyone spots anything that they don't like about them, please do send us an email. We will correct it. But the chairman of that part of the meeting was Councillor Bob Massey, and he did approve the minutes because under normal circumstances our AGM would be chaired by a city councillor. Unfortunately, obviously, this year things aren't as usual. We then have the next item, which is to receive our annual report, and you've all had the link to that. It's a weighty tome, and it has already been presented to the Southwood & Ferrers Town Council at a full council meeting, as we are required to do, and it has been accepted by them. After we've had the session with Mike, I will go through some of the contents of this, but in terms of formalities, it reports all of the things that we did last year, which we will come back to. I must particularly say we are extremely grateful to our funders. So in no particular order, Essex Community Foundation's Essex Coronavirus Response and Recovery Programme kind of gave us an £1,800 grant to help us with the increased activity for the 6 months following the COVID outbreak. Mr. G's foundation funded the development of our website and social media, which has been extremely important. Southwood & Ferrers Methodist Church gave us some money towards the work to set up the town nurse, which we'll come on to later. We're always grateful, particularly to Southwood & Ferrers Town Council, who support us and fund us on a regular basis. And also thanks to Southwood & Ferrers Rotary, who subsequent to the end of the last year's report, which is the end of April, have kindly agreed a grant for us towards our COVID activities as well, because it obviously seems to be going on and being a bit more complex and needy than perhaps we anticipated in February and March. Our accounts are an income and expenditure account is in as one of the appendices, and that shows that we have we do have a cash in the bank, so that will get us through to the end of this year. and we hope our funders will continue to be supportive and generous. So if nobody objects by chat, if anyone happens to have any comments subsequent to this meeting, please do let us have them. I'll now move on to the session, item 4, which is the time with Mike Gogarty. Mike is the long-standing Director of Public Health for Essex, and now also has the other responsibilities of Wellbeing and Communities. And we've given him a set of questions in advance that we've collated, which hopefully my trusty assistant is about to display. And Mike said that he's going to go through them, and we'll see how we get on. So over to you, Mike. Thank you very much indeed for your time. It's enormously appreciated that you're spending time, because I'm sure you are very, very busy, a very busy man.
So thank you very much for inviting me. I've got the, I can't see the questions, but I can get them up on my screen over this anyway. So Peter, thank you for all you're doing. Thank you to the group for all you're doing. South Woodham Ferrers is certainly one of the areas that I think is a real beacon in terms of community work, in terms of what it's done in community, and I sort of commend you for all the work you're doing. I noticed John, who runs the sort of and leads the Facebook groups right across Essex, but also Facebook admin group locally in South Woodham Ferrers, is on the line. And sort of, again, big thank you to that, even though I see he's now the test card. There's a lot of great work I'm aware of that's going on locally. I mean, you mentioned Mr. G, and Mr. G had already been mentioned to me earlier today in connection with the work that the foundation had been doing with the Prince of Wales pub in Stomaris, which has done huge amounts of work in terms of meals for people. And also, I understand is just about to lead on holiday hunger in the area as well. And while I'm on pubs, I have to mention the Curlew and the fantastic work they did rather before this happened, but in terms of mental health and allowing people to undertake mental health first aid training. So going to your list now, I mean, I was going to do a presentation, but when I saw your questions, I thought, well, actually, it's really good what you asked, and by answering your questions, I think I can probably cover up most of the things I wanted to talk about anyway, as long as they start moving around, bopping around the screen. I don't know if they are for everybody else at the moment, but hey, keep still.
That's okay.
So thank you very much for having me in terms of the first point. It is the best job in the world. It's always been the best in the world. More than ever, it's the best job in the world, although there's now a crop-load of responsibility with it, even more than ever. But I wouldn't want to be doing anything else. This is the most important thing I've done in 30 years in public health. What's it like for me? I mean, professionally, it is a real challenge. There's so little that people know about this condition. We are learning all the time. We are making terrible mistakes. And then we're rectifying those mistakes and moving on. And I think really it has been a huge learning curve for everybody in the profession. Personally, I found the whole thing extraordinarily humbling. It's not for you to thank me, it's for me to thank you. The only reason we're not facing a horrendous wave of disease which will kill many, many people is because of the positive good actions of the people of South Woodham Ferrers, the positive good actions of the people of Essex and the people of the country who really stepped up and embraced the requirement for lockdown. And it is only people's approach to lockdown that has enabled us, allowed us to suppress this disease. And I stress the word suppress because actually it hasn't gone anywhere. So have I been involved with the national strategy putting in practice in Essex? So we've constantly been feeding back into the national strategy in terms of what they should be doing, what changes we'd like to make. So there are a number of things that have happened around, for example, care homes and the management of people in care homes that have reflected on what we've said. The position about recording people going to restaurants and things came from work we've said. And as we move into the local outbreak plans, our local outbreak plan is what's seen as one of the best in the country and is being copied and emulated by a number of other people. And another area where we're leading at the moment is on adult community learning and how we might bring adult community learning back in line in September as the schools open and that. So I think the world of public health is actually very small when things like this happen, and the colleagues are learning from each other and from the centre, because those people you see at the centre, they're not terribly reassuring, but they're just ordinary people. They just happen to have that job. And a number of them, Yvonne Doyle, Paul Cosford, Jenny Harris, I've known for a very long time and know personally. I know a lot what they're going through. So I think really sort of they are doing their best and they're all working really, really hard on this. So how's Essex and South Woodham Ferrers fared? I think that while this country has seen more deaths than some other countries, I think we've managed it well. The worst case would have been we'd seen a huge pandemic wave sweep over us, and that hasn't happened. I think we moved at pretty much the right time. We are now absolutely seeing a reduction in every measure of coronavirus. It's great. We're seeing far fewer deaths, we're seeing far fewer cases, we're testing more people, and even though we're testing more people, the proportion that the number of positive tests are going down, the proportion of people that are coming back positive is reducing and reducing and reducing. Nationally, my understanding is that it's about 2% of tests now taken that are positive. And in Essex, it's much less than that at the moment. I think it's probably less than 0.5% looking at the most recent data. So I think we're in a good place. I think it's varied across Essex. I think in the south we've seen more cases than the north. I would say while the worst case scenario is talking about 80% of people being infected in the pandemic wave, I would say in Essex probably about somewhere between 5 and 10% have been infected, depending where you live in the county. The issue with that, though, of course, is that a lot of people are still susceptible. And another wave would actually be really, really bad news for us. So broadly, I think the country have managed this well. I think the government have managed it well, and that's simply a statement from me as a professional. It's not meant to be in any way political. I do think we've made a good job of this generally. I think when you compare to what's happening in the United States, for example, I think we're far, far better prepared, have a much better grip on it than others have. Where are we now? So as I said, I think we're in a good place. I think we're in the right place to start to relax lockdown. Summer's always a good time for viruses. Well, a bad time for viruses, a good time for people who are susceptible to viruses. And we are seeing a reduction in cases. The hard work that people have put in, the sacrifices people have made during lockdown are paying off. And we are seeing fewer and fewer cases. And I think even though we're relaxing lockdown, I think as long as that's done in a sensible way, and I think it will broadly be done in a sensible way. Just as a note to that, the actual initial work by that guy, Neil Ferguson, on the modelling that we're following, it doesn't actually assume 100% of people are sensible. There is a sort of a built-in sort of idiot factor within that. So there's always an assumption that some people will not appropriately behave, and even recognize, and that is recognised in the modelling anyway. So it doesn't freak me out that 100% of people aren't following the guidelines, as long as the vast majority of sensible people are so doing. However, I think things will change. I think that there are a number of reasons for that. I think, first of all, as winter comes on, all RNA viruses that we know about become more virulent. Now, we don't know about this particular virus, but there's absolutely no reason at all it should be different from any other RNA virus. So I would strongly suspect that the coronavirus steps up, becomes more virulent in itself towards winter, and that'll start pushing on the R number, pushing the R number above 1. Additionally, I think it's very, very difficult to get the schools back, all the schools back, and to maintain an R below 1. I think that's inevitable given both the nature of children, the nature of schools, and the number of children who've been involved. I think education is paramount. I think also getting those children back to school is paramount to managing the economy and getting the economy back on its feet. And if I look at my passion, which is around health inequalities, it is those people who can least afford it who are most badly hit by the coronavirus. It has been really discriminatory in terms of hitting those who can least afford to be hit. And we really do need to get the economy back on its feet. However, in doing so and improving the education to those who both need it, we are risking pushing the R factor our value above 1 again, and we will probably have to put increasing measures and lockdown in other parts of society in order to counter that. Thirdly, I think at the moment we're quite lucky. Well, he says looking out the window, not tonight, but generally speaking, the weather's been good. If the weather's good, it's okay for people to meet outdoors, and people are happy to meet outdoors. As we get into winter, that's going to be less and less acceptable, and people are going to be more inclined to meet indoors. The thing is much more virulent indoors than it is outdoors. Spread is much more likely. So for those reasons, the change in our number that the disease will have as it gets to winter, the increase in opportunities for spread in schools, and the increase in the opportunity to spread between people who meet indoors, as well as the relaxation measures we're seeing now, I think all point to a bumpy autumn and winter. We will see this come back, I'm pretty certain of it, unfortunately, and it may well be that we will see a return to lockdown in some form. So not good. There was a couple of additional questions from Jackie at the bottom. I want to take one of those now, which is the flu, which is quite interesting. Australia at the moment are seeing the best flu season they've ever had. The reason is, if you do the stuff you should do for coronavirus, so if you wash your hands, if you observe social distancing, you won't get the flu. So basically, people managing coronavirus is a really good way of managing flu. So actually, it may be, perversely enough, we don't have a lot of problems with flu as winter draws on. I think that waits to be seen, but that is certainly one of the scenarios. I think the other thing, which I think she's rightly asked as well, is I think that it will be problematic to distinguish between flu and coronavirus. And that will make the job of the test and trace services which are in place much, much harder. So I think test and trace will struggle as we get towards winter. We're only just starting at the moment. So what would make you and others consider a lockdown in locations such as Southwood and Ferrers? How might it be applied? Excuse me. So what we're seeing in Leicester at the moment is what happens. It's what viruses do. As we see fewer and fewer general cases across the country, the likelihood it'll be seen bubbling up in any certain place at any certain time is quite high. So I think the Leicester one is not going to be the first, or it's not going to be the last by any means, of local areas that are required to consider local lockdown. And thereby, but the grace of God kind of thing, it could well happen in part of Essex. It could happen anywhere. I think despite the best preventive efforts, I think it is going to happen, and it's going to happen. I don't know whether it'll happen in Essex. It may well happen in Essex. It may be part of a local increase. It may be part of a much more generalised increase. So it's possible you could have an outbreak in Southwood and Ferrers. It's possible you could have an outbreak in a larger place like Basildon or somewhere. In fact, probably more likely, simply because it's a larger place. And you could have widespread outbreaks everywhere that make us want to sort of lock down more severely. So I think it is absolutely certain we will have more localised lockdowns across the country, and there's no reason why Essex should be spared that in any way. We don't know how common or how frequent they're going to be, or how easy they are to manage. And I will talk a little bit about the outbreak plan towards the end of your questions. So how do I think communities are handling things? Oh, so how might it be applied? So I think that this is something that's taxing us a lot at the moment. There are only a very limited number of powers invested in me as Director of Public Health. There are actually rather more powers invested within the district councils, within their environmental health officers, because a proper officer function, and there's some powers of Public Health England. So if there are things like closing schools, working with NHS facilities, closing individual businesses, then there are ways in which we can do it, I think, quite easily without a huge amount of escalation. I think if we had to close down Southwood and Ferrers, if we had to lock down Southwood and Ferrers, then I think that has to go to the Secretary of State. And I think quite rightly it would go to the Secretary of State. So I think the two mechanisms would be, we have a Health Protection Board, which meets weekly, although we have twice daily updates at the moment on cases. And the Health Protection Board basically includes anyone officer-wise from the NHS, from each district and borough, from the city, from Public Health England, legal people, education people, adult social care people, the police. And we consider each individual outbreak that's going on. And it's no great secret. We have some outbreaks going on at the moment. We have 2 smallish outbreaks in businesses across Essex, and we have probably a few in care homes. There's been a couple in hospitals, and there's been a few in schools, although I think we've been reasonably spared. So we look at those. I think more importantly, though, we also look at this data. There's an awful lot of talk about Pillar 1 and Pillar 2 data, and I'm happy to discuss that. So basically, at the moment, we do have postcode data down to postcode area, and it's all very new, and we're just learning to map postcode data in a way that starts to enable us to identify where we might be seeing a general increase, a general rise in cases across Essex. We're learning all the time about the best way to do that, and actually even better than the number of cases is changes in the number of cases, and even better than that is probably changes in the rate of positivity in tests that we're doing. But we're putting all this data together and making a view on whether there's any issues. At the moment, Public Health England send us daily data on where every case, and daily data on whether or not the numbers of cases are more than you'd expect given the history for a given area. And we get that on district level. So we would have it for Chelmsford, we wouldn't have it for South Woodham and Ferrers. And actually Chelmsford have performed very well up to now, but we have had some areas that are red. But actually the way it's very easy to be red on those figures, and the general pattern is you stop being red very quickly. Again, not very far from here, Rochford has been red for a while, but it's now not red anymore. It's now moved out of that. We have another area in Essex where I would expect that'll go amber and then green very quick as well. But we keep a very, very close eye on the data and on the numbers. Should we see sustained increases in those numbers? If you think about this, we're starting from a very low number. So in South Woodham and Ferrers, we might have no cases in a week. We might have 1 case in a week. So if we started to see 3 cases in a week, we wouldn't freak. But then if it went to 6 cases, we'd start to take notice. If it went to 12 cases, then I think we really would need to consider some action, because we know once it's gone to 12, the next thing is it's going to go to 24, particularly if we don't know why it's gone to 12. So this is, and that's every few days you'd see those doubling. We know that the doubling time for these cases is about 4 or 5 days. So this isn't something that you go the next morning and there's a huge amount of cases. By measuring this and watching it very closely, something shouldn't jump out at us that we're not aware of. I hope that's not famous last words, but really that would be the approach. So should we identify an increase like that, it would be discussed in the Health Protection Board. As Director of Public Health, I would have to take a view on whether or not we needed to consider close down of an area, shut down of an area. That would then be discussed with Public Health England, who would bring it up through their routes to the Secretary of State. And we have something called the Outbreak Engagement Board, which is chaired by Councillor Finch as the leader of the County Council, and includes leaders from many of the districts and boroughs. And they would consider the position around that, and Councillor Robinson is on it from Chelmsford. They would consider the position locally as well. I would hope they would take notice of the Director of Public Health's view. And then we would proceed through the Secretary of State to organise local lockdown through the SCG, which is the Strategic Command Group, which includes the police, particularly chaired by the police. So there is a clear system and structure in place locally and nationally that will enable us to undertake a lockdown of South Woodham and Ferrers should it be required. And I would not hesitate to do so if I felt it was the right thing to do to preserve life and the well-being of the population locally. So how do I think communities have handled things? I think brilliantly. The only reason we haven't, and the evidence for that is we haven't had a pandemic wave. And we haven't. People talk about a first wave and a second wave. We haven't had a first wave. We dodged the bullet, which means it's still out there. But we haven't had a pandemic wave, and that's entirely due to the behaviour of local people and people nationally. It's got nothing to do with the NHS. We all clap the NHS. They've got nothing to do with it. It's down to you guys. You have stopped the pandemic wave. You have prevented the deaths. You have prevented the immense harm that would have been caused to society by a pandemic wave hitting us. So I think that it should be the people who are congratulated to receive the claps rather than any professionals. What's my message now? So I think there's some very difficult messages at the moment. As I said before, this is a very discriminatory virus, and it attacks those who are least able to manage, either through their own frailty or through the socioeconomic conditions in which they find themselves. So those people who are worse off tend to be those who are more likely to suffer severe disease and death, and also those who are more likely to have to go into environments where they're more likely to become infected. Additionally, they often work in industry, in jobs, in hospitality, where the areas have been hardest hit by the coronavirus and the implications of coronavirus in terms of lockdown. So if you want to get those people back into work, and they will probably suffer more from social deprivation and material deprivation than they ever would from coronavirus, then we need to start opening some of those shops, some of those hospitality venues. The problem is, in doing so, you have to compromise in terms of social distancing, because a lot of them can't manage 2 meters. Now, the reality is that 2 meters is better than 1 meter. There's no, that's the fact, that's the science. It's at least twice as good, and probably a lot more than twice as good. So one of my key messages to all of you is, please stick to 2 meters if you possibly can. There is no advantage in going to 1 to 2 meters, even if you have the masks and screens and the what have you. If you are in that environment and you're the person who's with you or yourself are infected, then whoever's close to you will be regarded as a contact and will have to self-isolate for 14 days. That's how the test and trace system works. If you are in the same same environment, but you maintain 2 meters distance, then you will never be asked to socially distance. So you'll never be asked to self-isolate. So if you retain a 2 meter distance, you will not be asked to self-isolate by those undertaking the test and trace, because you will not be regarded as a contact. If you're between 1 and 2 meters for more than 15 minutes, you will be regarded as a contact and will need to self-isolate. So one of my key messages is, try and stick to the 2 meters if you possibly can. Not always possible, but if you possibly can, try and stick with the 2 meters, because it is safer and it will protect you. What's the message to people wanting to go free? I think it's ill-considered. I think that you may be okay in yourself, but you're harming the population more widely. So at the moment, there are actually very few people today in Essex who have got this condition. I mean, today, very few. We're only, of the ones we test, as I've said, only 1 in 50, 1 in 100 come back positive, and they're the ones we test. So within the population at the moment of Essex, I mean, I'm busking it, but I would say probably 1 in 10,000 people have got it at any one time. So the chances of any individual bumping into somebody else who's got it as an individual aren't very high at the moment. They were much, much higher, and they're much, much higher in the States. But in Essex at the moment, they're not terribly high. The problem is, over a whole population, if people stop recognizing social distancing and stop adhering to that, it'll start to come back very quick. And then in a few days, it'll be 1 in 5,000. Next couple of days, it'll be 1 in 2,000. Next few days, it'll be 1 in 1,000. Before you know it, it'll be everywhere. So we've seen the way it can exponentially spread. So I think it's really important that people retain social distancing and do not go free on this, because it will attack you. And even nobody is safe from it. Nobody's immune from it, in the sense that it won't be harmful. There are children who've got very, very ill with this. There are young people who've succumbed from it. So nobody is safe, and it is a very, very horrible, nasty disease. So what's my message to people who are still shielding and isolating and extremely cautious and nervous? So bearing in mind what I've just said, I think the positive side at the moment is very few people have got it. You can go out, you're very unlikely to bump into somebody who has it. If you do go out, keep more than 2 meters from somebody, or keep more than 2 meters from everybody, and the chances of you getting it are very, very low, so you can be reassured in that way. However, it remains just as harmful to you as it ever was. So I think extreme caution and nervousness is not at all unreasonable. I think I would be very nervous if I was in that position. I think that if you want to sort of meet with another family, as you're able to with one other person, then I think it's reasonable to do so. If you want to go out and be extremely cautious and observe the 2 meters, then you are very likely to be safe. The other thing that's happening at the moment is that the government are working very hard with the people who developed the risk tool for heart disease some years ago. So it's Professor Hippersley Cox in Oxford, to devise a very sensitive and appropriate risk measure for everybody who's been asked to socially isolate and is an extremely high risk group. Because actually it turns out that some of the people who are in extremely high risk group are very high risk, but some of them probably not that high risk at all. And the application of this tool, which has been developed at pace, would allow people a much clearer view about just what their individual risks are. And it will be much more sensitive. And having that degree of sensitivity and selectivity for those who are particularly at risk would allow a lot of people to go out, and will make it very clear to those people who can't go out that they can't go out. And that's being worked on very quickly. So hopefully within a few weeks, that will be rolled out, and it will be rolled out by your doctor. So doctors will have to assess everybody individually and give them a sense of what the real risk is for them. Anything else you'd like to cover or say? I don't think so. I think you give me the opportunity to cover everything off. What I would like to do is answer any questions that people have got. And many thanks for your time tonight and all the work you're doing. So I will shut up, and I will very happy to take any questions if people would like. Thank you very much for your time and attention. Thank you.
Do you want to answer the first of Jackie's questions? You answered the second one during it.
So yeah, absolutely, there will be another wave of coronavirus. I'm going to go back on that, because there hasn't been a first wave. So we ducked the first wave, or we ducked the wave. We suppressed the wave. The wave remains suppressed. The nightmare scenario is we get a wave. I don't think we will get a wave. I think we'd be really unlucky to get a wave, but I do think we'll see, as we did before, an increase in cases, and further lockdown will be required in order to maintain that suppression. So I think that wording is quite key, because if it had a wave, everyone would be immune because it's gone through and everyone's had it, and that's not happened. And I don't think it will happen, and I really hope it doesn't happen, because that'd be awful. We are definitely better prepared in terms of stocks of PPE. Absolutely. I think we were taken by surprise earlier in the year. That's not going to happen again. I think that there is more than adequate stocks of PPE, and that will continue to increase. I think the equipment for testing for COVID-19, there's lots of different bits to that at the moment. So I think that the ability to identify the virus itself quickly, so that's the sort of RNA replication tests, are getting really good, really, really accurate. And also there are machines now, like the Samba 2 machines that a lot of the hospital have, which can do that in half an hour. So now there are machines, they're not everywhere, unfortunately, but there are machines that can do this in an hour. The testing facilities are now phenomenal. The capacity is just enormous for testing. The speed of turnaround could be better still, I think. But certainly, I think by the time we get to an increase in cases in the winter, we should have 24-hour turnaround on tests. That should be possible. The other thing we're struggling with at the moment is a test of immunity. So increasingly, they're looking at the antibody tests, and antibodies come into the blood when you've been exposed in the past to the condition. And they exist at the moment. Of course, in Essex, we'd say 90% of people will be negative anyway, because most people haven't been exposed. The problem at the moment is that recognition of that exposure does not equate to immunity. So you can have a positive antibody test, but that doesn't mean you're not going to get it again, nor does it mean you can't give it to somebody else. So the antibody tests are of extremely limited value at the moment, and that's partly because we don't know enough about the disease. So I don't think we're going to be caught short. I think we'll spot the thing coming quick. I think there's lots of PPE in place. I think the tests are improving very, very quickly. I think within short order, we probably will have an effective antibody test, but I haven't got a crystal ball. I can't say that. Obviously, the holy grail here is a vaccine. I don't know where we are in terms of vaccine development, but it would be great if we could have that within several months, and that's not impossible, but would be optimistic. The other holy grail is a treatment that's so effective that basically it wipes out any sort of seriousness in this disease at all. And for that would have to be a 95% effective treatment. We've already found that dexamethasone in certain cases is 20-30% effective in reducing the sort of severity of the condition. So I think we've, compared to where we were in February, March, I think we've advanced a long way, and there's no reason we won't advance a similarly long way by winter. So long answer, but I think it is a long answer. I think we will be well prepared for the return of this condition and not a second wave. We'll avoid a second wave, he said, hopefully, or first wave even. Right.
I will pick I bet, Mike, that in all your years, you've never actually experienced anything like this, and you would agree that this really has been an unprecedented thing.
Yes, absolutely. Absolutely.
Yeah, it's the first time I've used the word unprecedented and thought like it really applied.
Well, actually, if you think about it, unprecedented, everything's unprecedented, if you want to look at that way.
Oh, you're meant to be
by definition.
Okay, so I can already see a question, and I do encourage people after that illuminating, informative and comprehensive presentation, for which I'm sure we're all extraordinarily grateful. Questions on chat are very welcome, and the first one comes from Val. Will care homes need to continue the current level of lockdown until the end of the year?
So it kind of works the same as everybody else. I think care homes have been extraordinarily problematic over the last few months. That's because you know, and it's one of the things I think we did get wrong, and I'd hold my hand up, we got it wrong, and that was that there was an absolute pressure on keeping hospitals open. There was an absolute pressure on keeping those ITU beds open. People were worried about, you know, the throughput, people coming to hospital and having nowhere to go. And I think people were discharged into care homes without being tested, and people were discharged into care homes who were infected. And that led, after a few weeks, to the extraordinarily devastating levels of care home infection that we saw around Easter time and a little bit after. That fortunately has stopped. Nobody now gets into care home who might be infected. And again, the learning around how to protect care homes. There was very little published evidence on how to do this. We were literally doing this on the hoof, to the extent that in Essex, we decided we wanted to do things differently, and Public Health England agreed with it. This was on a Friday. We learned something on a Friday. We decided we wanted to do something different in Essex on this Friday. On the Saturday morning, Public Health England agreed to do a pilot trial in Essex, and on Sunday we'd actually started recruiting patients into that trial. That's the pace at which we were doing things, and that's the pace. And Essex was then informing some of the stuff that's going on nationally. So what we know now is hugely more than we did previously. A lot of it is about preventing stuff getting into care homes in the first place, which it reflects on the question. Currently, we fortunately are seeing much lower rates of infection in care homes. We changed the definition of infection in care homes quite early on in the outbreak as well, because initially one thought, well, people were saying, and Public Health England was saying, definition of an outbreak is 2 cases in a care home. By the time there were 2 cases in the care home, it was everywhere. So we had to change it to 1 suspected case. So that's why a lot of the numbers jumped up in terms of the numbers of care homes that had infections, because we changed the definition. So anyone that had a suspected case became treated as a potentially infected place. We learned a lot more about infection control in care homes, particularly the importance of staff and staff transferring infection in from other care homes. So I would say absolutely there will be some elements of lockdown that will stay in care homes. I would think that keeping visitors out as far as possible will remain good practice. I would think that staff moving between care homes is an absolute no-no. Absolutely must not happen. People must not admit to care homes unless they've been tested and shown to be negative. They need to go into self-isolation for 2 weeks beforehand, if not possible. That PPE practice needs to be absolutely scrupulous in care homes. Hand washing and cleaning of the care homes need to be absolutely scrupulous. I think by doing that, we can really reduce the risk of infections in care homes. The reality is social distancing doesn't work in care homes. Once it's in there, it'll spread. The other thing that's happening now is that staff are started being tested weekly. in care homes and residents monthly. I think personally, weekly testing of staff may be a bit of overkill, but I can understand why people wish to do it. But there's scientific reasons I don't think it's a great idea. But I think as well in Essex, we've taken a more robust approach to excluding positive, much more in line with the WHO guidance than the national guidance. I would see this as an area where, as cases reduce generally, they will reduce in care homes, and as our ability to manage and control and prevent infection in care homes continues, we'll see fewer and fewer cases. But I would say that a degree of lockdown and a degree of caution is absolutely good to nursing homes and care homes, and will continue.
I suppose the obvious question to follow up from that is, when will the Duchess of Cornwall and the rest of us grandparents be able to hug our grandchildren, and when will people with elderly relatives in care homes be able to go and give them a hug?
I think that's a difficult question. I would remain cautious at the moment about that.
Yeah,
it is very difficult. I would remain cautious about that. Yes. Risks are reducing, but and I suspect there will be some latitude. But I think it is. You know, we've seen this infection in care homes, and it just goes nuts.
And it's horrible. I mean, I've seen it. It's the most horrible thing I've seen.
And it spreads and spreads. It's just, once it's in, it's really hard to control. You've got to stop it from getting in.
Yeah. And the behavioural science has been the big key in this, hasn't it, really, in terms of when lockdown started and how long it was expected that people would adhere to it?
So that's not my specialty. But I would say that I'm impressed with the way people have behaved. That I think people welcome straight talking, and they welcome straight questions, straight answers, and clear facts. I think that generally speaking, that's been okay. I think there are a few kind of weaselly words being said at times, which I don't think were helpful. I think, although I can understand that there was a lot of thought behind what they were. So, for example, the Prime Minister saying that if we all go into lockdown in 3 weeks, we'll have the thing on the run. Well, actually, yes, in 3 weeks, you will see the cases will start to reduce, but you have to keep in lockdown for a lot longer than that before you can stop the lockdown, which wasn't entirely clear to some people, I think. I just think people are learning so much all the time about what is frankly a very new disease. I think that it's hugely complex because of the impacts it's had on society widely. You use the word unprecedented. I think that's absolutely right. And we're literally learning day to day and continue to. But I think people have been great. I think population have spurred themselves this.
Yeah, thank you, Mike, for that. Just a brief one. If there was a lockdown, for argument's sake, in South and Ferrers, how would that be organised and policed, as it were? And I don't mean that in a capital P case, but you know, would someone come and put a boundary up and barriers up, or
no? I don't. So this is a discussion we're having at the moment, and looking at and learning from Leicester. I think that the people of South Woodham Ferrers will be very sensible. Will recognise the needs for it. We'll probably close schools. We don't restaurants, venues. I think that we would. I don't think there would be a draconian policing approach. I mean, the position of Essex Police has always been to support, to enable, to encourage rather than enforce. And I think that's the right way forward. I think if we start getting really heavy and sort of doing that, like that movie with Dustin Hoffman in it, I don't think that's going to work. People aren't going to want to go to South Woodham Ferrers anyway if there's infection there. But it's okay. Well, if it's a hotbed of infection. And it's okay if you want to go. And people will be allowed to go out to work. You know, if they live in South Woodham Ferrers and work elsewhere, that's okay. You know, it's not going to be like The Simpsons. There's the other one in a dome in The Simpsons. It's not going to be like that. It's going to be just a reintroduction of local lockdown, closing businesses, closing schools, encouraging people to social distance more, encouraging people not to meet in big groups. But it's going to be encouraging and advising, not, sort of a big dome.
Okay, we have a question from
We do.
Roger. Hi, Mike. 10 plus years ago, re-swine flu, there was a central control mechanism in Essex for both predictive and reactive issues run by Phil Reed in the then Mid-Essex PCT. This was intended to be fast reacting and responsive. It was 3 years in the planning and could have predicted some of the problems now being encountered. Are you comfortable with the processes now in place and that they can cope as was predicted 10 years ago?
So the good thing about the swine flu thing is we never tested. It was never tested in live action. So I was involved very deeply in Essex in the swine flu. I was the Director of Public Health at North East Essex, and we had lots of plans and lots of ideas, but they were never tested in the way that this has been tested. So I think the amount of work that's been done this time and the amount of learning this time is, it's magnitudes greater than what we did for swine flu. Am I comfortable with the processes in place and that they can cope as was predicted 10 years ago? I'm learning all the time. We're learning all the time. I guarantee we've got it wrong. I guarantee that we got the Essex test, trace, contain and enable service up and running at the moment, which is phenomenally different from anything that was there in swine flu. Much more advanced. The technology is much better in terms of IT for a start. We have links, we have national and local testing and tracing services. The Essex plan is felt to be one of the best in the country and is being held around as good practice. However, and also we're starting before anyone else because I just want to get going. So even though the systems aren't entirely up and running, I've been running it and testing it. And every time we test it, something goes wrong. But nothing serious and nothing that impacts on people's health. But in terms of the system, it's very bumpy, it's very clunky, and that will smoothen that out and that will develop and that will improve over time. But we are really learning on the go. So today I had a meeting. I'm listening to our enhanced services. I pulled back in 3 retired communicable disease consultants who've recently retired from across the region to support us in Essex. I think we're very well placed to deal with it, but I'm not going to, I'm a worrier. I'm not going to say I'm comfortable with the processes now in place. I think that we'll be okay, and I think we'll muddle through, and that's kind of what we do a bit. But I think we've got as good systems as anybody, and we are probably more willing to learn than others and keen to get up and at it. So I think if anyone can do it, we can, but I'm not confident, simply because we don't know the scale of the thing, particularly as it gets into winter again.
Yeah, it's a voyage into the unknown. And you've mentioned something, I think you've been very kind in thanking us. I think we ought to record our thanks to all of those people who have come out of retirement, as you've mentioned. All the people who come back, and all the students and everybody who's piled in. Taken on unfamiliar roles, and I think it's been a great team game. Actually, I think everybody's played their part, and without any individual bit, there wouldn't have been the whole approach. So I think you're right that everyone's stepped up.
I did kind of want to add that, Peter, because actually, where I said, am I comfortable with the processes? The reality is, whatever my processes are, however good they are, if the people of Essex, the people of Southwold and Ferrers don't behave appropriately and responsibly, that's what's going to stand and fall on still. My test and trace service, my prevention service is only going to work if people recognise and adhere to social distancing, remain alert, are appropriate in their behaviours, because that's what's going to keep the thing away from us. And in the other group, I think it's important to mention, we've got students from ARU doing the calls and all this as well. It's the volunteers. It's the way the community have stepped up to support each other. Because one of the jewels we had developed was the Essex Welfare Service, which again grew from our current support service for loneliness and social isolation, but was really, again, through the work of John, who's on the call here, on the test card, and the Essex Coronavirus Action Page, which John and colleagues set up literally overnight. We've had a phenomenal response from the communities, phenomenal response to people. We were having like thousands of people coming forward for volunteering. We're having hundreds of requests for people to have support, and the average time went down to less than a minute between a task being put on the internet and somebody picking it up. We had volunteers picking up tasks by the minute, and it was just phenomenal response, absolutely phenomenal. And that's nothing that I'm responsible for. That is you as a community, and that I keep saying, it's you guys who are going to manage this outbreak, not me.
Thank you. I think you're right, and I think local has worked really well, and we need to think about how that can be made sustainable. A lot of really good groups have jumped up. I would give you the feedback that the national scheme hasn't worked well, and I'll happily give you lots of examples of that another time. But I mean, I have one just today, and when I rang the people up, it was all over days ago. I'm afraid the Good Sam one has not, the national scheme really hasn't worked, and I think it's proved that it's local communities that know their communities react. I mean, we literally, the GPs got onto me on the Friday and the pharmacists, and by Monday we had a scheme up and running, and we've delivered over 1,700 tasks since the 23rd of December, March rather. You know, and yeah. I know that similarly happened in Chelmsford, Danbury, Malden, etc., because I keep bumping into the people. And I think it's proved the worth of local groups and volunteers, quite rightly. But it has been a team game because it's needed coordinating by people like you, and everyone's needed to play their part.
You guys, and South Woodham Forest have been really good.
Sorry, we have another question.
Yes.
How can we mitigate the risk of asymptomatic infected people? Should we assume that we could all be in that position and keep our guard up? So
the asymptomatic one's always been really complicated. I'll come to the particulars in a minute. But the reality is, if you keep 2 meters from... first of all, anyone symptomatic shouldn't be out there anyway. They shouldn't be. So they should be self-isolating. So the only people who are people who haven't yet shown the symptoms. So the 2 meter rule is basically to protect you. If you stay 2 meters from anybody else, and you are protecting them from you potentially having it, because you're not within 2 meters of them, and you are protecting yourself from them not having it. So as long as the 2 meter rule is fastidiously adhered to, asymptomatic infection isn't an issue. It only becomes an issue when that 2 meter rule is breached. Now, there are a number of different elements around this. Why would somebody be asymptomatic and infective? So the most common one is probably that they just haven't shown the symptoms yet. So usually people start to become infected between 24 and 48 hours before they show symptoms. And they can be quite infective at that time. So that's kind of a clear, obvious group. The problem with them is you can't test for them and there's no point unless you get your tests back within 24, 48 hours, because by then they've got symptoms anyway. So you know they've got it. So one of our issues, and that's one of the issues for me with the care home testing every week, that unless you get your test results back very, very quickly, then there's no point doing it, because those people who were going to get the infection would have had it by then, and they're isolating. So you'd have to have the test results very, very quick. There's also a group of people who are carriers over a longer term for some reason, some immunological reason, and we don't really know much about them. Nobody knows very much about them in terms of how infective they are, how long they carry it for. We do know that a lot of people test positive for quite a long time afterwards, but the sense is that is not equated to infection. It's just a residual positivity on the tests we do with dead virus rather than a real infection. The other group that we have to worry about then are people who actually have very, very mild symptoms or no symptoms at all. And what's been found in a lot of those cases, they actually do have symptoms. So a lot of people who've been tested and come back positive and say, because I don't know what, they haven't had symptoms, and they go, oh, actually, now you mention it, I was feeling a bit dodgy a couple of days ago. Oh, I did have a little bit of a temperature the other day, yeah. So a lot of the people who are quoted as asymptomatic actually aren't asymptomatic, just very, very mildly symptomatic. But I say the way to mitigate any risk is not go within 2 meters, and that if we do that, we actually say we could be in that position. We're not going to infect anybody. No one's going to infect us.
Mike, are you going to be able to stay with us until 8 o'clock?
I
Be honest.
I can't see the time.
7:30.
I can answer a few more questions, but if, with your permission, once you've finished my bit, I will probably go.
All right. Okay. Right. In that case, there haven't been any more come up. I'll give people a couple of minutes just in case any more come up, and I'll just pick up a couple of points. Very interesting to hear about the postcode data. Will that be published by ONS in a timely manner?
So I don't know what so at the moment it's not. It's available to us in public government. The degree of secrecy in forms I've had, I mean, I'm not very good at IT and things like this and information governance, but the number of bloody forms and to jump through to get data is being huge. So I suspect that in the short term, it won't be that widely published. I think that they are publishing Pillar 1 and Pillar 2 data by district and borough. And at that level, it will be published. I think the postcode data, I suspect the numbers are so small that they start to become identifiable. So I think probably not.
I think the really good news that you've given us is that you're on top of this. You're seeing,
no, I didn't say that.
I am. You're as on top of it as anyone is, by the sound.
Yeah, I think that's fair.
And I think it's very reassuring to us to know that you are looking after us, and you'll know if we've got a problem, and you will be in touch, and you'll do the necessary.
Yeah, absolutely.
But that's really, really helpful. I just want to say how grateful. I know you've been very kind about us, but I believe we're in very safe hands. You're a very experienced man, and I don't think we could be in better hands. And thank you for your leadership and for looking after us. We're here if there's anything we can do to help you anytime.
Thank you.
Know where we are, and hopefully you've been very kind and recognised the efforts that people have made, and we stand ready to do anything we can. So please don't hesitate to ask us.
Thank you very much. Again, to the community of South Woodham Ferrers, who have always been a beacon, have always been a shining light, have shown leadership in this. I mean, I thank you, because actually, you know, I can't do this. This is something that society, this is something that communities have to do themselves to prevent this disease. And I think we've done a really good job of it, and we just need to carry on with it. And there's lots of banana skins out there. We just have to be really cautious.
Thank you. But we couldn't have done it without people like you, and without you in particular. And Essex, as always, is doing its bit.
Thank you.
We will let you go. We are just so grateful for your time. When I'm sure that you're being pulled in all sorts of directions, it's very good of you to recognise that, you know, communities like us are worthy of the input, and I think that's important as well. So thank you very much indeed.
Thank you, Peter. Thank you.
We all wish you all the best, because
And
I
you.
think we all know that people like you and the people we've been seeing on the podium, etc., are going through it, and we can see that they are taking it personally and taking it seriously. So, you know, just please pass on our thanks.
Thank you very much. Thank you for your time and attention. Thank you. Good night. Cheers. Stay well.
Can you take your screen off our screen, please?
What am I looking at?
Didn't you who put the questions up? Was that you or Nikki?
Nikki.
Oh, right. Oh, sorry. I thought you had. Right. Okay. All the best.
Thank you. Bye now.
Yeah. Nikki, could you please move us on to the slide for item 5, please? I do hope that everyone found that really fascinating and illuminating. There's nothing like hearing it from our own horse's mouth. and Mike's a very good bride. I'll be fairly brief because we've been on a long time. So I'll zip through things now, but happily take any questions if anyone wants to put them up about things now, or if anyone wants to send in any comments afterwards. So our last year has been a very active one, and it's long. It was a huge issue, and really from last summer through to Christmas, everything was about the new Crouch Vale Medical Centre, and then eventually they moved in, and they're up and running. And to be honest, we couldn't be in a better building for a situation like this, albeit that we'll always argue that it's in the wrong place. Nikki's screen is still showing Mike's questions. Yes, I agree. Nikki, you're still thank you. Well done. We need to get back to the agenda, don't we, please, when you're able. So we're on the slide for item 5, if you can manage that. Well done. Excellent. So we then started the exciting journey on the town nurse project. We have got that going. The aim of that is to put into the town centre, where there are no other health provider services, a town nurse, which is somebody who will provide support, advice, signposting. They won't do treatment, but this initiative has been thoroughly welcomed by the local NHS and promise of very good cooperative working. And I think this is a really good initiative. So thank you very much to Val and the Methodist Church for suggesting that good idea. It is progressing. Obviously, it has been suspended for a few months, but things are now moving along. We've got a Zoom meeting in the coming weeks to organise the logistics for it, and the national organisation for town and parish nurses has got its plan together for future activities, and we'll let you know what the timetable for the start of that will be. It certainly won't be before the end of this year now. Then obviously we've had COVID-19, so the transformation of our group has been a really important factor. I must thank the previous administrator, Emma Wardle, who came in towards the end of last summer, and between there and Christmas set up our brand new website, which enables us to do things like this and be able to publish it, which is fantastic. So we've been absolutely ready. Our social media presence is up. So our ability to communicate is great. We're receiving stuff from Public Health England, CQC, all the national organisations. We're filtering it. If you want to know about all the MRC research projects that are going on, I know, but I can assure you I don't bother you with the ones which are highly technical and I don't understand either. But we're getting information from all potential sources, and anything that's of relevance we're either publishing or we're putting as a reference document on our website in case anyone's interested in more detailed stuff. Our communications is improving, our reach is improving. We're sending out our weekly bulletins, and I think we're an authoritative source of comprehensive information, and it's a very timely thing. So enormous thanks to Emma, who then left us to concentrate on Essex-wide projects and ventures, and a great welcome. Nikki is a fantastic administrator without whom none of this would be possible. I'm pleased to embarrass her, and I can assure you that she makes all the wheels turn, and even laughs at my jokes, which is very good of her. Huge thanks to the volunteers who've joined us. Without them, it wouldn't have been possible for us to deliver the over 1,700 tasks that we've now delivered. The vast majority of them are delivering meds, but in recent weeks, it's become less quantity, but heavier complexity. So as we were saying to Mike, those people who are shielding, isolating, etc., who are naturally cautious, who are going to get the benefit of customized conversations with their GPs and doctors, etc., They still need our support, and we will be there to deliver that, and we'll be ready if there are more outbreaks, shall we say, rather than spikes. So that, I think, covers our activities and happenings. Please, if anyone's got any questions about any of this, do put a note on the chat. As a note, we have suspended, as so many organisations have in these circumstances, with the agreement of the Town Council, we have suspended our governance for 12 months. We haven't needed to suggest any constitutional alterations, and like a lot of other organisations, we will hold elections next year, and the present officers are able and willing to continue, and at this stage we think continuity is important. We haven't had any dissent to that, but if anyone wishes to make any comments about that, we will take them seriously and we will publish them. Okay, so what are we going to do? Well, I'll zip through this fairly quickly. We're going to carry on extending our reach and what we're doing. We are developing a series of interviews, and really having Mike Gogarty tonight was one. We've already published online a sort of a question and answer with the medical director, the clinical director for our primary care network, who were working for South Woodham Ferrers, and we have others in the pipeline as well. So rather than, we're going to be having more virtual events, which was something we were planning to do more and more anyway, so this has been very timely. These days, physical meetings don't attract a big audience unless it's a particularly controversial or attractive subject. So that was something we were already moving to, so we were ready for this. We will continue to be advocates for effective patient and public engagement, and we will continue to represent the town in all the forums that we do, and we are very much encouraging people to represent the town and our people and patients on the new foundation trust for acute hospitals and for our mental health services in the county. And we also want to make sure that our voices are heard in the amalgamation of the clinical commissioning groups for Mid and South Essex. So the transformation plan for the hospitals, we're well known on the record. We believe that amalgamation helps save lives and improves recoveries, but it does involve the challenges of distances, etc. And we're always banging on to the medical and social care authorities that if they're going to consolidate services, they need to think about the patients and families and carers, etc., who need to do the extra travelling. The development of the primary care networks is an important thing. The town nurse is something which we will develop as quickly as possible, and we will continue to be ready to deliver support to COVID-19 happenings. I'm now pleased very briefly to tell you about a project that we're launching today, which is what we're calling the Student Support Project. We will have heard the Chancellor today talking about the importance of supporting young people into employment, etc. And we're aware that there is one constituency in our town which is badly affected by the pandemic, and that's our students. So we're offering a bubble for students. We have to make it 18-year-olds and above, because otherwise we get into safeguarding issues. So it's basically year 13 school and college leavers. People who are hoping to start university or college in the autumn, people who are already taking university courses and college courses, and those who are coming up to the most extraordinary arrangements for finishing things off this summer and wondering what on earth they're going to go through. So we're offering a package for these people. We'll keep them informed of things that are relevant to their interests and things that they want to do. We'll provide some mutual support, and we will put on weekly Zoom discussion fora and hopefully perhaps attract a few experts to join that. At the moment, we're saying that we'll run it until the end of September to get people through the summer and on to the next stage, and we will review it. So please, please, will you let families and people in the town know that if there's anyone who would like to join in, there's no cost to anyone. It's just meant to be something that will help people. And we just think that that's a constituency that's worthy of support. And obviously, you know, we'll stick to our specialist subjects for that. So please do tell everybody about that and encourage them to join up. All they need to do is contact Nikki at the email address. Okay, thank you very much indeed. Any other business? If Val Carter to everyone, will that be advertised in Focus? Yes, yes. Today I've sent it to William de Ferrers and to Anglia Ruskin University, and we will be now, after tonight, we will be publicising this, promoting it on social media, in Focus, etc. So it should be in Focus next week. So hopefully we'll be able to hit everybody before the end of the school. And John Water, thank you very much. You'll get it out. Wonderful. That's fantastic. John is a one-man PR machine. So we're very grateful for that. So any other chats, any other comments? Golly, we're going to finish by 1:45. That means I can go and watch the cricket. Oh, sorry. Oh, hold on a minute. I can get it out to the youth. I propose a vote. Oh, all right. David proposes a vote of thanks to somebody. Oh, it's all right. It's just disappeared. So I can't quite see that. Nikki can. Thank you ever so much to everybody for attending tonight. Please do spread the message about the importance of health and social care. Please, I hope everybody accepted and understood the messages that we got from Mike Gogarty. And I hope that everyone will take what he said seriously, and those messages can be spread. And we can help to continue our extremely good community support. Where is Clarky? Please introduce him. Wait, come on, Pop. They want to see you. Oh dear, come on. Well, look you up. Here we are. Here he is. This is a black German Shepherd cross retriever, 7.5-month-old trainee guide dog. 35 kilos. I've nicknamed him Arctic, as in articulated lorry, because he's that long. Thank you, Clarky. Well done.
Peter, sorry to interrupt. It was from David. He wants to propose a vote of thanks to you for uniting the commitment to health of this town. So thank you for all you do.
Thank you very much. I wouldn't do it if I didn't love you all. And it is humbling to be able to see people, but thanks everyone. It's a team game. We couldn't do it without Nikki. We couldn't do it without the volleys, David, Jackie, and all the others who support us. Thank you very much. And as I'm saying to everybody at the moment, stay safe, stay alert, stay happy, and stay healthy, and hopefully see you next year in a more realistic situation. Thank you all very much indeed. Good night.
Mm-hmm.